Hi, this week we're going to be talking a little bit about time and money. For psychotherapists or therapists or counsellors, I'm probably going to be addressing the reasons why you are likely never to get rich, unless you're a TV star or your name is Dr. Phil. For clients, I'm going to explain to you what you get for your typically 45-minute to 60-minute consultation. In the case of private practice, that is. And I'm going to use my own practice as an example of some of the things that you didn't know. Firstly, clients typically come to me via an email inquiry or by telephone. Most of them come via email, an inquiry from my website, and they like to set up their first appointment using email. And that typically means that you have 3 or 4 emails going backwards and forwards from each of us before we finally settle on a time. So it's time consuming. And some clients will telephone you directly. Sometimes they have to leave a message if I'm busy with clients, because I never bring my phone into the counselling rooms. So that's usually a lot faster and a lot easier, but a little bit of time gets spent setting up the appointment. Most therapists and counsellors in private practice do not have the luxury of secretaries and administrative staff, so we tend to do everything ourselves. So what happens next? Once we've decided on an appointment, before I even get anywhere near to seeing the client, I prepare a couple of folders. In the first instance, I prepare a manila paper hard copy folder, as well as a digital folder, which I keep in duplicate. And into that folder needs to go a bunch of documents that are quite important. A new client form that allows the client to give me some basic information about them, their doctor, their next of kin, the sort of things that you'd fill in when you go to see a new doctor. I give them a document called Things You Need to Know, which is really a summary of some of the things that I'm going to need to tell them in the first session anyway, especially things relating to confidentiality, things relating to punctuality of appointments. I don't want a client to turn up while another client is here because they happen to be 20 minutes early, things like that. Here in New South Wales, because psychotherapy and counselling is not a regulated profession, I have to give them a copy of a document that spells out the code of ethics for so-called unregistered health practitioners. I prepare a DAS 21 for all of my clients before they arrive. This is a depression, anxiety and stress assessment, which they take home with them, fill in and bring back next week. I also prepare a document called a brief mental status exam, which is something I complete when they leave, which is my assessment of a whole bunch of things that I have observed about them. Okay, so now I have this manila file. I also have in it a typed note about what we've talked about on email or on the telephone as an introduction. So the file is essentially opened, and it takes a bit of time. Then we go to the consultation itself. The client turns up and gets 45 minutes to 60 minutes, sometimes more, sometimes a lot more, depending on what gets discussed. And that's the bit that they see. They get their consultation and they go away for another week, having paid me. But what happens after the client has left? This is where the real work of the psychotherapist happens, in solitude. What happens afterwards is I go and I take my notes, which in most cases are between 2 or 3 foolscap pages, and I type them up. This takes me roughly an hour, just as long as the consultation did, because not only do I need to type my notes carefully and thoughtfully, but I also use my recording of my notes on the computer as an opportunity for me to reflect on what was said, how it was said, what the context was, and so on. And often little lights go on in my study while I'm doing that might not have occurred to me during the psychotherapy session itself. So not only am I typing up my notes, but I'm also preparing myself for where I think it might be useful to go to in the next session. So it's not just notes, it's reflection. Also, often whilst typing up my notes, I may see something which I may or may not have noticed in the session that tells me that I perhaps have a deficit in an area that was raised, and perhaps I need to do a bit of research before I see the client another time. It has happened where I've had a client who's presented me with something so off the wall, such a curved ball, that I've actually rapidly enrolled in a full-day course to prepare myself for what I think might happen at the next session. The client doesn't know these things. The client doesn't know that I still continue to work for them once they've gone home after a session. So, then I'm ready to put the client's file away, presumably, for the next week. But not entirely so. And remember also, by the way, that one of the reasons we keep very careful case notes after each session has nothing to do with tidiness. If my client becomes involved in something untoward, there's a court case, for example, a judge can subpoena my records. A judge can say, I want to see your therapist's notes, or I want to have your therapist in court to be questioned. And certainly here in Australia, judges and magistrates are not shy to say that a therapist's notes are rubbish. So we have to be quite careful to make sure that our notes are meaningful, accurate, and a thorough reflection of what's going on with our client. We have no right to decline a subpoena. We have to comply. So now the client's gone home. I've typed my notes. They're all nice and ready. I've done a little bit of extra research if I needed to, which may take half an hour, a whole day, depending on what's going on. Have I finished for the week? No. Next week arrives, and at least half an hour before my client turns up, I'm taking out those case notes again, and I'm taking another look at them, and I'm familiarizing myself with what happened in the preceding session, or sessions, so that when the client sits in front of me, I am not stumbling around trying to remember what they said. I have to spend at least 20 minutes preparing myself with the information from my notes, but I also have to start putting myself in the mood for this particular client. I have to psych myself up, if you like, for this particular client. And as most people will know, every client is different. Some are extremely challenging and it can be an excruciating hour. Others can be very easy to work with, a pleasure to work with. Some are not necessarily a pleasure to work with. And you need, as a therapist, to prepare yourself for that particular client. So I said earlier on that we were going to talk about time and money. Can you see that the client who has paid X amount for his 45-minute or 60-minute session has had the session, and that's all they're aware of? They're not aware of the additional hours that gets spent on their case, or the preparation before they are seen. The client is actually buying a lot more than just 60 minutes of my time. We all watch too many movies and we see a lot of very bored looking shrinks, dull and uninteresting and uninterested in their clients. But that's not how it works in the real world. We have a passionate interest in our clients. We have to. It's why we do this job. Right, so some of the costs that are involved in terms of both time and money that the client is not aware of. I can think of two straight away that are obligatory for therapists here in Australia and in most places around the world. Number one, here, for every 10 client-facing hours that I spend, I have to spend at least 1 hour with my own shrink, with my own psychologist, with my own supervisor, as we call them. These are the people to whom we unpack our issues. These are the people with whom we discuss difficult situations that we think they may be able to help us to deal with better. So every counsellor, every therapist has his or her own therapist and counsellor. For every 10 hours we spend looking at clients, we have to spend at least 1 hour with our own supervisor. And that costs money. It costs me more money to see my supervisor than it costs a client to see me. There are other things too, time and money. Here in Australia, in order to maintain our registration as psychotherapists and counsellors, we have to do what's called OPD. People have different names for it around the world, but here we call it ongoing professional development. And in order to maintain my registration, my license to practice, every year I have to achieve a minimum number of points in order to maintain my registration. In other words, I have to take on extra training, I have to do extra research, perhaps present papers and courses. I have to show that I am learning new things with every year that goes by. You don't just get licensed to practice and you can do it forever. You're constantly under pressure to spend both your time and your money on these things in order to constantly improve your practice and maintain a standard that is acceptable in our profession. So at the end of the day, remember the client is paying for and has an expectation of spending 1 hour with you. But many hours go into each client's case that they're totally unaware of. You thought therapy was expensive. I discussed this with a physician a couple of weeks ago and he asked me, so what do you charge per hour? And I told him, I'm not shy to mention my fees, they're published on my website. And he looked at me in amazement and he said, but I couldn't live on that. My response, of course, was, yes, well, unless you're a Dr. Phil and a celebrity television psychotherapist, you don't do this job to get rich. And none of us are. I hope that was useful.